A 68-year-old male presented with pyrexia and fits. I am showing you a contrast-enhanced brain CT scan. Describe the findings.
Okay, looking at the images. The contrast-enhanced axial CT of the brain demonstrates multiple ring-enhancing lesions in the left frontal lobe. Each lesion is surrounded by a prominent zone of hypodense vasogenic oedema. Although no discrete lesions are visible in the right hemisphere on this slice, there is significant mass effect and vasogenic oedema in the right frontal lobe as well, implying contralateral lesions.
I am showing you Axial T1 post-contrast and coronal T2 weighted MRI scans of the brain. What do they demonstrate?
In that case, the Axial T1 weighted post-contrast MRI confirms thin, uniform, smooth rim enhancement of the left temporal lobe lesions. The corresponding coronal T2 weighted MRI shows a central hyperintense abscess cavity with extensive hyperintense surrounding vasogenic oedema. This oedema is causing moderate mass effect and mass displacement of adjacent parenchymal structures.
What is the diagnosis? Explain the pathology, common locations, and predisposing risk factors.
Well, the diagnosis is multiple cerebral abscesses, currently in the late capsule stage. Pathophysiologically, cerebral abscesses develop from focal cerebritis, which undergoes central necrosis and capsule formation over 10 to 13 days. They most commonly arise via hematogenous dissemination from a distant source, typically presenting at the gray-white matter junction in the middle cerebral artery territory. Predisposing risk factors include diabetes mellitus, chronic steroid therapy, and other immunocompromised states. The medial wall of the abscess capsule is typically thinner due to poorer white matter perfusion, predisposing to rupture into the ventricles.
What is the differential diagnosis for ring-enhancing brain lesions? How do you differentiate them radiologically?
Okay. The differential includes cerebral metastasis, glioblastoma multiforme, resolving hematoma, and demyelinating lesions. Cerebral abscesses typically show thin, uniform, smooth ring enhancement with a thinner medial wall. In contrast, metastases and glioblastomas characteristically demonstrate thick, irregular nodular walls with central necrosis. Furthermore, unenhanced CT scans show a hyperdense peripheral rim more commonly in metastases than glioblastomas.
Discuss the role of advanced MRI sequences. How would you manage this patient as a radiologist?
Diffusion-weighted imaging is highly specific, showing restricted diffusion with high signal on DWI and low signal on ADC mapping due to viscous purulent fluid. Necrotic tumors conversely demonstrate facilitated diffusion with low signal on DWI. As a radiologist, I would recommend immediate chest radiography and paranasal sinus CT to locate the primary source of infection. I would alert the referring clinical team immediately of the risk of intraventricular rupture, and consult neurosurgery for urgent stereotactic aspiration and targeted intravenous antibiotic therapy.